It is now year 3 for the Affordable Care Act, also known as Obamacare, as open enrollment season begins today. So do the headaches. Average premiums this year are expected to rise 7.5% for at least 3 dozen states. I want to bring in Dr. John Patrick right now. He is author of the book, Health Attitude, Unraveling and Solving the Complexities of Healthcare. Dr. John Patrick, good to have you on the program. Thanks so much for joining us.
Thank you. It's nice to be here.
We've been talking about economics this morning and the fact that we may very well be on the cusp of a recession sometime next year. Do you attribute the cost of health care, Obamacare, to the fact that we are seeing such a slow economy?
Definitely is a factor. When it grows faster than any other segment, then it's going to take a bigger and bigger share. It's approaching 20% of our economy.
And it's much more expensive than people thought.
It's a lot more expensive.
Yeah. Explain it.
Well, there are a lot of issues in healthcare. It being so big, you would expect there would be a long list of issues. But the number one issue is the cost. We spend almost twice as much as other countries in the world per person than any other developed country. And it's not because we're getting twice as good a care. It's because we have like $1 trillion of unnecessary tests and procedures. We have a huge amount of expense in healthcare.
How do you fix it?
Well, I'm optimistic about this. There are several ways to fix it. One is consumer awareness of what their alternatives are. Consumers are beginning to track their own health with mHealth devices. They're beginning to be more proactive and ask more questions of the doctors. Do I really need that test? Do I need that procedure? And if you convince me I really need it, well, where can I get it? And where do I get that MRI? And the answer isn't, well, down the hall. The answer is I'm going to go to the web and I'm going to search around and I'm going to find.
Are people really doing that? And is it changing their health, though? Because you have, it seems like you have people who are more interested in their health, but it's a small slice of the overall population. And you still have 2/3 of this country that are overweight and obese.
Yep.
So, and we're not seeing that trend change.
Well, it's a growing capability that people have as the smartphones that we carry around in our pockets and purses, these are like supercomputers. They're more than 100 times more powerful than the first supercomputer. And people are beginning to realize there's a lot they can do with that on their own. They can gather data. Studies are clear. If you track your health, you're going to be healthier. Yeah. And capabilities now, like you can take your phone.
I love it.
Yeah, it's
see the
amazing.
sensor on the back. You can hold it like this and do a 30-second EKG.
It's like paddles, man.
For free.
Where'd you get those sensors on the back to put on the back of your phone?
It's called AliveCor. It's a startup company. And it does a 30-second EKG. It's not the same as a 12-lead EKG, but it's the same as a 1-lead
It's a good
EKG.
start.
It's a great start.
How about on the other side of this, which is the companies? Last week, Valiant made a ton of news because CVS and Express Scripts said, hey, look, you're taking pricing on us that we didn't know. How much of that pricing that you've seen, S&P, for example, if you look at the healthcare sector, revenues are up like 7.5% for the quarter. It's the only sector that's magically creating all this pricing against the consumer. How much of this is the corporate side taking responsibility in what they're charging?
Yeah, well, drug pricing it's a real issue. The healthcare, generally speaking, is coming under control. It's coming down to single digits. The cost per person is actually beginning to decline, but the cost of drugs is running at double-digit rates.
How do you bring that in?
Well, step number one is really easy, or it should be easy, and that is to allow Medicare to negotiate the price of drugs. This was put into the legislation in 2003, that Medicare, which then was maybe 25% of the action, now it's 65% of the action.
As opposed to letting price just ride. I mean, come on.
Yeah. Can I ask you for a verdict on Obamacare? The Obama administration says it's expanding the number of Americans who have coverage and bringing down costs. Critics of their plan say it's doing just the opposite. And it's very hard to sort through who's right in this debate. What do you see? Is it working or not?
Well, Obamacare has 10 parts to it. We don't hear much about most of them. We hear a lot about the insurance, who's in, who's out, deductibles, premiums, rising costs, and so on.